The big story today: will Singapore impose more restrictions in a bid to curb the spread of Covid-19? Opening in Tampines, the country's first community treatment facility for Covid-19 patients. Packed and ready for delivery, suppliers of antigen rapid test kits tell us there is sufficient stock here. You're watching The Big Story. I'm Haryanto Diman. Now remember to subscribe to the Straits Times channel so you never miss a single episode. Starting operations today, Singapore's first community treatment facility at Tampines Street 22 has received its first Covid-19 patients. Up until yesterday, it was known as a stepped-up community care facility for patients who are generally well but have underlying health conditions that require close monitoring. 3 patients were seen arriving at around 11 a.m. Staff in PPE rolled out wheelchairs to receive 2 of them, both elderly women. This facility at NTUC Health Nursing Home has been fitted with 250 beds, with infected nursing home residents prioritized for admission. To ensure that beds in such facilities and hospitals go to those who most need them, home recovery is now the default mode of care, accounting for up to 40% of cases every day. But there is still some confusion surrounding it. The Health Ministry today releasing its response to address issues such as complaints about the long lag times between testing positive and being given information about home recovery or being taken to a facility. What should you do while waiting? MOH says to self-isolate in a room, preferably with an attached toilet. If you have to leave the room, wear a mask. And if you're not feeling well, there's a list of telemedicine providers to call at this website. You'll get an SMS with more info on what you should do during home recovery. But MOH is urging patients as it continues to beef up resources and set up the home recovery buddy system. Also, ask your household members to self-register for an electronic quarantine order here. What if you need to leave your room during home recovery? According to MOH, if you do need to step out of the room to collect your meals, for instance, make sure no one is near the doorway to your room. Put on a surgical mask before opening the door, complete your task and return quickly. And looking ahead to the end of the home recovery period, when can you be discharged? MOH says no discharge memo is needed. If you're feeling well, you are discharged on the 10th day of illness. There's also no need for further PCR tests because vaccinated people are extremely unlikely to be infectious by this time. As at yesterday, there are 1,083 Covid-19 patients in hospital, 26 fewer than the previous day. 145 cases are seriously ill, requiring oxygen supplementation, and another 19 are in critical condition in ICU. Of those who are very ill, 134 are seniors above 60 years old. Professor Dale Fisher is here to assess Singapore's current situation. He's a senior consultant at NUH's Division of Infectious Diseases. Welcome to the show, Professor. Professor, while the number of patients in ICU remains relatively low, 19 as at yesterday, there are over 1,000 still warded at hospitals. Would you describe that as overwhelming the healthcare system?
Thanks for having me back, Haryanto. No, really what we're talking about is the number of people that need intensive care, the number of people that need oxygen or are deteriorating and might need oxygen, these type of people. Actually, there's still a lot of people in hospital that, if you like, are left over from the period when we were still admitting everybody to hospital or some to community care facilities. So some of those rules are still being tweaked, and I must say very successfully the number of hospitalised patients that don't need to be there for reasons of hospitalisation, that number's coming down. The numbers to really look at are the ones that are on oxygen and the ones that are in intensive care, which is still quite manageable. And furthermore, to deal with any risk of being overwhelmed, as you know, there's the development of really some innovative efforts to create new facilities for different categories of patients. So less people will have to be in hospital for the, just in case we're going to observe you, they can be observed in community facilities, which are a little bit more ramped up for observation and even providing some oxygen. So also there's other people, such as those infected in nursing homes. They could be completely well, but they need to be taken away from the other residents of the nursing home so they don't get infected, but they need care. So rather than providing that care in hospital, then hopefully we can have facilities where we can provide that care while they get over what is probably and hopefully a very mild infection with COVID.
So, Professor, having said that, are there other numbers that we should be looking at as well, apart from ICU or seriously ill? Say, for example, the number of patients that have been discharged, for example.
Not really. Of course, we like it when patients are discharged, but the burden on the hospital is really, though, and on society for that matter, is the people that are severely well. Someone coming into ICU is going to be there for 2 weeks. That's the average. People on oxygen, it'll be a bit less. But no, I guess if you're going to look at anything else, you would be looking at the number of people that get infected, particularly seniors, and particularly if they're unvaccinated, because they're the ones of highest risk of progressing to seriously ill. So we're still very concerned about seniors that get vaccinated, that are unvaccinated.
Professor, the current wave of infections emerged about a month ago. Is our COVID-19 situation peaking? And if not, when do you think that will be?
So this is one of the unknowns, really. We don't know how high this peak will go. We want it to go slowly, right? We don't want to see a big spike in severe cases. That's exactly what would overwhelm hospitals. So we'd like to see we're back to the days of trying to flatten the curve. We'd like to see a gentle rise in the numbers. And I think this is precisely what government's looking at, because if that rise is not gentle and it's too steep, then we know that hospitals can become threatened, and that's when you're likely to see some community level interventions to try and cool things off and stop the numbers. As I say, particularly if you're seeing large numbers of elderly and large numbers of unvaccinated people infected, then they're the ones that we worry most about, both for their own health and for the health of the health system.
Health Minister Ong Ye Kung told Lian He Cao Pao this week that the government is monitoring hospital capacity and may have to impose more restrictions if the situation worsens. Professor, based on what we've just discussed, the number of hospitalized cases currently, those seriously ill as well, are we heading for tighter restrictions?
Well, I think I can comfortably say we're not going to look at a rapid easing of restrictions like many would have hoped. I'd like to think the travel restrictions, the quarantine for return travellers could be lifted, because really we're only finding 4 or 5 cases a day that way. And when there's 1,000 in the community, it doesn't seem like there's a particular advantage in going to so much trouble to find these 4 or 5. But having said that, I think we're certainly not likely to see for quite some time, mixing of large groups for social occasions and things like that. But will we go backwards? I think this is the big question. I think it's possible. I think it's more likely to be restrictions than it is to be, harsh lockdowns. Everyone go back into your house and close down non-essential businesses. I don't think we're talking that, but it might be limitations in dining or something like this, the mask off activities, but actually it's the ministry and the MTF that know where the clusters are happening. So I guess the restrictions are more likely to happen in those particular settings. I hope it doesn't happen. We're certainly, I guess, knocking on the door of that. But But we have to get through this wave. We have to get to the other side. If we said, let's lock down and stop trying to exit, then we're just going to have to face it another day. Many, or not many, some people are saying, why don't we just stop all this and go back into lockdown? I think you need to remember that there's terribly sound reasons for coming out of this, and whether it's people's mental health or whether it's livelihoods or whether it's other non-COVID related diseases, we have to, after a year and a half or more, confront this and say we need to get through this, and we want to do it as carefully and safely as possible, which is a precedence, especially compared to other countries that have had a lot more severe disease and death than us, obviously.
Prof, thank you so much for your perspectives. That was Professor Dale Fisher, and Senior Infectious Diseases Consultant at NUH. If you've been trying to get your hands on more COVID-19 self-test kits, there's some good news. Suppliers of antigen rapid test kits tell the Straits Times that there are months' worth of stock in warehouses and shipments are arriving every week. It comes amid surging demand for ART kits, with more people required to get tested before going into the office or to events. At one warehouse in Pandan Loop today, we saw workers loading up the kits and getting them ready for delivery all across Singapore.
At this moment, we have inventory coming in on a steady weekly shipments. We have already delivered 1 million tests to Singapore just last week alone. Okay. Our approach to allocation is holistic. We will balance and allocate stocks to 3 different sectors. One is the healthcare providers and community care. Second is to retailers, so that it meets the public requirements. And last but not least, to essential services in the industries, as well as to the factories. And currently we have enough stocks to last all the way to the end of this week. By next week, on Tuesday, we will have another 500,000 tests coming through. And by the end of October, another 6 million.
According to the Health Sciences Authority, among the recipients of the Pfizer or Moderna vaccine in Singapore, there are 10 suspected cases of cerebral venous thrombosis or CVT, a very rare type of blood clot in the brain. HSA noted, though, that none of these vaccine-related cases was fatal. It also cannot determine if there's an increased rate of CVT associated with the use of mRNA vaccines, because CVT can happen naturally regardless of vaccination. There are risk factors, including a medical history of blood clotting disorder, head trauma, and the use of medications like oral contraceptives and drugs for hormonal replacement therapy. Moderna's CEO Stefan Bancel told Swiss media that he thinks the pandemic could be over in a year, as increased vaccine production ensures there'll be enough doses available by the middle of 2022 for everyone to be vaccinated. Boosters should also be possible to the extent required. Mr. Bancel added that even vaccinations for infants would soon be available. And for those who aren't vaccinated, he said they'll immunize themselves naturally. In other local headlines, Singapore's top marathoner YONG has been ordered to pay $180,000 to his former teammate Ashley LIEW for defamation. Back in June 2019, LIEW had filed proceedings against over 5 statements about an act of fair play during the 2015 SEA Games marathon. LIEW said he had slowed down to allow other runners to catch up after they missed a U-turn and took the wrong path. He'd received 2 awards for showing sportsmanship. Disputed LIEW's account, though, in 2 blog posts, 2 Facebook posts, and 1 Facebook comment. Last month, Singapore's core inflation rose to 1.1% on a year-on-year basis, up from 1% in July, the fastest pace in more than 2 years. This comes amid higher food prices and a smaller decline in the cost of retail and other goods. Meanwhile, overall inflation in August eased slightly to 2.4% from 2.5% the previous month. Panasonic is laying off 700 employees in Singapore amid a shutdown of its refrigeration compressor manufacturing operations. Although the division's business and R&D activities will remain, the layoffs make up about a third of the company's total workforce here. You can't navigate through Netflix these days without coming across Korean survival drama Squid Game. In fact, it's the #1 offering in Singapore today. Well, in a nutshell, the drama is about 456 debt-ridden contestants who willingly take part in a series of playground games for an astronomical cash prize. But at first, they have no idea that these games come with deadly stakes. Here with a review is journalist and our pop culture vulture, Jen Lee. Hi, Jen. Jen, how did you find it? What worked and what didn't?
So I think what really worked is how exciting the series is. It really is like every episode is a little bit of a blockbuster, you know, something happens and it's very like you want to find out what goes on in the next episode. Like every episode has something really, really exciting. Like I remember watching the first episode as a screener and I was like blown away because it was so fast paced and immediately like the stakes were illustrated to you. And then, you know, the second episode, it was kind of like then it was taking a step back from the game a little bit, but you also see like how dire the circumstances are for the people involved in these games, you know, when they are outside of the game and they are trying to deal with their real world problems and debts. So I think that's what really makes it exciting. And it like just kicks into high gear even more, right? In the third episode and so on. So I think it's the kind of show that is truly binge-worthy. We have a column at Straits Times Live called Binge-worthy where we recommend shows, but Squid Game is definitely like a bingeable kind of show. It's the kind of show that you want to finish in a sitting, you know?
But Jen, viewers will be familiar with the survival premise. You know, they're hardly a novelty. We're talking about the Hunger Games, Alice in Borderland. Anything different in Squid Game?
I think what this one strikes me as is how as much as the premise is a bit fantastical, you know, they're like at a mysterious place. There's this mysterious organization running these games that with a huge cash prize. Where are they getting their money from? Of course, there are a lot of questions. But at the same time, it is taking place in real world South Korea, right? Like, for example, things like, you know, Hunger Games, that's a dystopian fiction, you know. I've actually never watched Alice in Borderland, but from what I understand, it's also a bit of a dystopian fantastical setup. But this one is like, they are real people living in South Korea. They are just extremely poor. They just have made really, really bad financial decisions, perhaps. They are just in a bad situation. And that's when they get approached to play this game. And then they, you know, embark on this journey. So I guess there's a very strong South Korean flavor to it. Even the games play, right? Like Squid Game itself is a game that I'm not familiar with. And I think it is something that South Korean audiences and South Korean citizens would know much better than I, because it's a South Korean TV show. So there is that context there that I think brings a different type of flavor to it.
Well, thank you so much, Jen. I'm certainly looking forward to binging on Squid Game, which is out on Netflix. And certainly, you know, it's only 9 episodes. I think that would be quite bingeable. Now, moving on, Marvel blockbuster Shang-Chi topping $300 million worldwide. And like what the movie means for Asian representation, its soundtrack album mainly features Asian acts as well, from different countries and genres. Our music correspondent, Dino Abdul Hadi, is here and he spoke to the three of them. He said to share more. Hi, Dino. Dino, what did he have to say about what this means for showcasing Asian talent in the music industry?
So I spoke to some of the artists who were involved in the soundtrack in an online press conference, and you could tell that they were all blown away by getting to sing, to rap, and write music for a blockbuster Marvel movie. One of them, Rich Brian, is a rapper, He emphasized how it was a huge move in recognizing the big strides that Asian artists have made in the American music industry in the past few years, especially in the hip hop world. Now, the three who spoke at the press conference, Rich Brian, like I mentioned, Nikki, and Warren Hugh, they are all artists under the banner of music collective 88 Rising, which is an American company based in New York that has been working hard in promoting Asian talents in the music industry in the past few years. So in the US, for example, they have this annual music festival that has been dubbed the Asian Coachella after that famous music festival. And Rich Brian himself, he made headlines back in 2018 when his debut album Amen became the first by an Asian act to top the iTunes hip hop charts. Warren Hugh, the other guy on the soundtrack, he's a newcomer. He's only 19 years old, so getting into the soundtrack is a big boost for someone like him. And like Brian and Nikki, he's from Indonesia, but all three of them are now living in the US making music. And this was what Warren says during the press conference. I quote him. He says, "We just wrote from our perspective of our culture, and it's always going to resonate with the movie because obviously we are Asian artists and we are speaking from the point of view of how we grew up." And to add to that, Nikki says that doing the soundtrack is a career high, and she says that it's awesome to be part of a project where you feel directly represented and you are recognized as an Asian person.
Thanks, Dino. Now you can read Dino's story online or in tomorrow's paper. By the way, Shang-Chi will premiere on Disney Plus on November 12th to celebrate its inaugural Disney Plus Day. And before I go, food editor Tan Sherien is here to talk about Limbo Rojak. Hi, Shwe. Shwe, why have you chosen to highlight this Penang Rojak stall today?
Okay, well, actually the stall is supposed to have a link with a KL rojak stall called Uncle Lim's Rojak. And I really like the sauce. I'm not wild about the fruit and the vegetables that are in the salad, but I really like the sauce. It's thick and it's not too sweet. If you eat there, they will toss the sauce with the vegetables and the youtiao and whatever together for you. But if you do a takeaway, if you do tapao, they will separate the youtiao from the fruit and vegetables, and then they'll give you a little container of the sauce. So that's what I did. When I started patronizing the store, was to do a tapao. And when I got home, and I had the sauce, it was so good. So these days, I just buy a jar of it, right? And then when I'm at home, I stick it in the fridge. And then if I want to eat it, I'll just squeeze a bit of calamansi lime juice and put whatever chili sauce is in my fridge and stir it up. And then I dip my vegetables into it. I have bangkwang or cucumber, and then fruit will be rose apple or Granny Smith apples. And I even do like pan-fried tempeh. It's so delicious with the sauce. It's just thick and rich and wonderful.
You're making my mouth water right now, Shwe. Well, thank you so much for coming on to the show. You can find Limbo Rojak at 64 Joo-Chiat Place. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below. I'm Haryanto Diman. Thanks for watching The Big Story.